The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Well, it's a bright and happy Saturday morning, and I've got
cold.
It is? Well, you're cold.
Outside.
I've dressed warm. But I've got the happiest man. I was saying to Dr. Mencia that it's why his practice is so good and why he's such a good physician. He's so disciplined. He comes here early. He's all prepared. He's bright and cheery and so happy.
All the research done and everything.
Yeah, it is.
It's a boring life.
But you are a very special man, and I know that's how your patients feel. And we have a very exciting subject this morning. Why don't you share that?
Yeah, we're going to talk about the links that exist between oral health and medicine. A lot of times, people think that if you have diabetes, if you have cancer and you're going to go for chemotherapy, if you have heart disease, what have you, people don't link the what goes on in your mouth with the rest of the body. And there is a tremendous connection. As a matter of fact, I remember in Mount Sinai, New York, when I was there, we had a patient with an ulcer in the sole of his foot. I think it was the right foot, because the guy used a cane to ambulate, and he has to use 2 canes at this point to ambulate, and he couldn't drive the car because you use your right foot for the pedal. So it was very difficult for him. And we started digging and digging. He has a tremendous abscess in his mouth, and the bacteria traveled from the mouth through his body, and it came through the sole of his foot. And we even published the case and everything. So, a lot of times people don't make the connection between gingivitis and, let's say, coronary arterial disease. So we want to talk about that, educate people about those conditions. And what a better month to do it than November. You know why?
Why?
It's called the use or lose situation.
No. That's for something else. Wait a minute. I'm not even going to go through this again.
I know. There she go with her sexual stuff, Richard. Oh, my God.
How can we go from teeth to sex, right? Well, it's okay. Listen. No.
Use it or lose it. If you have insurance, when your employer or you buy dental insurance, from January 1st, the clock starts ticking. You start, collecting, accumulating your benefit. Now, at the end of December, whatever you have collected does not carry over to the next year. It gets wiped out, and then you start all over again.
So my advice is to everyone run to
my office.
Right, run to Dr. Mencia's office.
I have the whole dental department all
that's
gown,
ready because
hand wash, and ready to go with a mask on.
When you think about
I saw yesterday, I saw Rosemary walking around with her mask. I said, "Well, you think I'm not going to recognize you?"
Oh, she's recognized. She's gorgeous hair. But I want to go back to this. So you're saying, let's say that someone has come for their teeth cleaning, and yet they've had they need a filling or something. So if they get in now, that's all covered before the end of the year. But if they wait, then it starts into the next year,
right?
And it's just that much less they're going to have.
If you have $800 worth of work in your mouth that you have to have done, and your insurance, let's say, cover $500. If you don't go and use your $500, January 1st, you're going to have to put out of pocket, part of that payment, because it won't cover the full $800. So if you have $500 and you use that $500, now by January, you can then add the rest, and you have your full care covered by your insurance.
Okay, and so oral health, which you started off saying,
there are many complications. For example, with cancer therapy, most people know that there is a link between cancer treatment and nausea and hair loss. We all know about that link, but many of us don't know that more than 1/3 of the patient develop oral complication during cancer therapy or after cancer therapy.
Oral complications like what?
Well, they can have a problem with their teeth or their gum, the soft tissue. For example, if you're getting radiation to the neck for thyroid or something like that, the soft tissue around in your mouth can also show some complication that we're going to go into. And the moist lining of your mouth, as well as the gland that make the saliva, can be affected. Now, if your saliva shut down, you are so prone to developing caries in your mouth. So it is important that if you, God forgive, you have to go for chemotherapy, it is extremely important that you go and get your mouth taken care of. By the same token, when you go to your dentist, if you have had chemotherapy, especially recently, let them know that you have had this or that you are in the process of getting chemotherapy. And then what happens is when you develop this condition because of chemotherapy, it's going to make it very hard for the patient to eat, to talk, and to swallow. And then it makes you, because chemotherapy makes you more likely to develop infection. You are really shutting down. When you receive chemotherapy, you're trying to kill the cancer cell, but you are really shutting down the immune system. So the person becomes very, very prone to infection. And in your mouth, in my mouth, we all have a lot of anaerobic bacteria that live there. This is their home.
So I have a suggestion for everybody listening. And we know that a lot of people are devastated when they've heard that they've had cancer, and then they have this big program of chemotherapy, and thank goodness a lot of people are living and they can be healthy again. But I think before you even go to chemotherapy, go see Dr. Mencia. I am sure he will develop a program for you that if you're under chemotherapy, these are the things to watch out for. This is what we want to do. We want to see you during, before, after.
Exactly.
And I'm going to give the phone number right now because
954.
He's dancing on, you should be here. We're going to have to televise this, so people won't believe you. The number is 954-489-1345.
And we are open on Saturday.
And yes, you are. And it's funny. And he runs to go to his office.
Oh, I
and
love
you're pretty
going to
busy
my
there,
office.
aren't you, on Saturday?
God, we're so busy.
Isn't it amazing that Saturday was the brilliant thing that you decided to do to help people?
And guess what? Now I'm going to have ultrasound on Saturday. Dr. Gillette is there seeing patient today. It's so cool. We have the nutritionist coming in on Saturday. It's
That's
becoming
fantastic.
a full practice on Saturday.
Right.
Dental comes in on Saturday. So, it's really...
It's rare. It's rare.
It's very rare. On Saturday,
But that's who you are. You do it to accommodate people. He had so many requests to come on Saturday that he is now a 6-day-week physician. And this is pretty special, everyone. We are so privileged to have him on the show, The Wonderful World of Wellness. And it really is. And that's what we want to do now. We want to talk about oral health and how it affects the rest of your body. So you're saying, Dr. Mencia, that actually someone could have a problem in their mouth, not know it, and all of a sudden other parts of their body are affected.
Other parts of the body can be affected. So what are the prevention that you can do? If you are far away, you cannot make it to the office, and you are undergoing chemotherapy and you have problem with your mouth. One of the things is you want to stay away from sharp, crunchy food, because your mouth becomes very sensitive. You don't want to break the mucosa. That's the barrier that you have between the outside world and the inside world. So hot, spicy, or high in acid, like citrus juice and fruit, you want to stay away from those kind of food. Sugary food. Sugary food is so important. Not whether you are a diabetic or no, okay? But sugary food, when we are in the microbiology department and we're trying to grow bacteria, we take sugar and blood. And then we take the bacteria, and the bacteria grow exponentially. That's
Oh
how
my
bacteria can grow so quick.
Oh, really?
So imagine in your mouth, you take sugary food, you're getting chemotherapy, your immune system is down, you have plenty of blood flowing through there. It's just, one thing that is very important for the Pencil Talk audience that we have there. Toothpicks. Do not use toothpicks in your mouth.
Toothpicks.
Right. You can floss, you can do other things. Don't use toothpick because you can break the mucosa again.
Toothpicks.
Yeah. And then, of course, alcoholic drink because, it can affect, Okay, Richard, take off the toothpick of your mouth.
But it's also alcohol is sugar.
That's
right?
correct. That's correct.
So in other words, I never thought about this. So your whole mouth, your gums, everything in your mouth is going to be more sensitive and more prone to disease and pain with chemotherapy. Do people? I bet doctors. I don't know, but I bet doctors who deal in that the radiation oncologists and all, they may not even tell anybody that.
That is correct. That is correct, and that's
we're going to write an article in our December issue on oral health because it's really important. Use your insurance, but please go and get checked, right? At your office.
That is correct. And it's not only chemotherapy. People might say, "Oh, this show is not for me." What about regular condition? If you have periodontal disease like gingivitis, the ultimate outcome of periodontal disease is tooth loss. You're gonna lose your teeth. That's what's gonna happen. So if you have periodontal disease, and when you look in the mirror, you look at the skin that surrounds your teeth, and if they are inflamed and red and sometimes even sensitive, the further this goes, the higher the chance of losing your teeth.
Well, I have to give you an applause because I went to your practice, and I bought the best electric toothbrush in the world.
I use mine.
It is fantastic. I mean,
my kids have theirs. I mean, it's
what's
really
it called
cool.
again? It's the Sonic.
Sonic K or something like that.
Yeah, but the toothbrush that they will sell you. Oh my gosh, it is the best, and it has for your gums, it has for your teeth, it has everything.
Exactly. You can massage your gums.
I know it. I love the toothbrush. It's really a wonderful toothbrush, and
I even use it to mix my coffee. No, I'm just kidding.
Yeah, you mix your coffees. That's right. But no, seriously, I've had electric toothbrushes before, but I've never had one like this. And I know that Dr. Rosemary told me that you have the best one, and I went ahead and invested in it. It's great.
We do have a research department in the practice where we research about medicine and all the things. But also, when we're gonna bring anything to give to the patient, we make sure that we do our research. Before we put it there for the patient for anything. Let it be a vitamin we're gonna sell the patient, or a
make
toothbrush.
Sure you test it first,
and that we get in the best. That we don't want to, we don't want the consumer to be fooled through us.
Yeah, but it is wonderful, and I just have to compliment you because I didn't think I needed one. Thank you.
Thank you very much.
But let's get back to that because I'm very careful about my gums.
Gingivitis. So when you have periodontal disease, one of the things is that people, and they don't know they have bad breath. And that's a turn off. When you come close to somebody, if and you get close to that person and you start talking, and the other person have to hold their breath because your mouth smell so much. Some people, they think that if they are edentulous, they have no teeth left, they don't need to see the dentist anymore.
Oh, that's interesting.
Of course you have to, because you can have oral cancer. So you need to go and get checked and get your mouth examined at least for
So you're
oral
saying
cancer.
that people who have dentures still have to go?
You still should go, just like a person that had a hysterectomy need to go to the OBGYN and still follow up, because you can still develop vaginal cancer. Because you have no teeth doesn't mean you cannot develop oral cancer.
Wow,
so,
that's
if you
a
are
good
at
point.
risk,
Good point.
So bad breath is one thing. The connection, to me, the most important connection, because we have so many people suffering suffering from heart disease and stroke. But there is a strong correlation between people with heart disease. They tend to have 1.5 to 4 times different researches that I reviewed last night for this show. The research have shown that people with heart disease 1.5 to 4 times increased risk of periodontal disease.
Really? Why is that?
Because what happens when you have periodontal disease, you have this bacteria is overgrowing in your mouth. That's a great question. Why? Because, the mechanism, how this happened, when I was reading, I say, wow, I was amazed. I want to be a dentist someday.
No, you're not going to be a dentist.
Maybe I'm going to be MD, DDS, PBS, CBS, NBC.
No, you have enough on your plate now.
No, I don't want to be a dentist. I'm happy being a doctor.
Yeah, I know.
So let me tell you why.
This happens.
Let me tell you why. So you have periodontal disease, and then every day, some of the things that we do, some of us don't clean our mouth every day, but which is unfortunate. But
really?
We should. But let's say you do wash your mouth every day. So every time you wash your mouth, you are taking those bacteria that is in the tissue around your teeth, and you are sending them through the bloodstream. And those are anaerobic bacteria. They love living there. Those bacteria, they enjoy being there. They love it. They reproduce very quick in there. Also, when you are chewing food, you eat 3-4 times. When you are chewing anything, just the mechanism of chewing food will take those bacteria and make them then circulate through your body. And what we have found out through the research in medicine is that when those bacteria tend to circulate, they take the blood vessels around the heart and take the wall and make that wall thicker.
Really?
So therefore, you don't need a big cholesterol plaque to block the blood vessel anymore, because now the lumen had decreased so much. So by making the wall of the artery a lot thicker, and the other correlation that had been made is that the more severe the periodontal disease is, the higher, the stronger the risk of having coronary arterial disease or stroke.
Do you find this when you're examining people and they have problems? That's why you have a dental department, because then you see it and then you send them there?
Well, yeah, what inspired me is I have one of my, originally was his wife and his daughter were my patient. And he was sitting outside in the waiting room, and my patient, his wife, say, "Can you see my husband? Because he has this abscess in his nose, and it's very painful." And I say, "Sure." So we brought him.
In his nose.
So we brought him inside, and I look and I ask him, "Do you pull the hair on your nose or anything like that?" He say, "No, nothing like that." And I say, "Okay." So I went and I punctured the abscess, I drained it, I put a little bit of medicine inside, a little bit of antibiotic inside the abscess so it can dry it out and he won't end up with a scar. And he did everything, internally, so everything, nothing will show us a scar on his face. And since I'm doing something that have to do with ear, nose, and throat, what you need to do is check the sinuses, make sure that there's no fluid in there, open his mouth, check his mouth. When I open his mouth, lo and behold, he's in the front on both left and right, he has horrible cavity in there. I mean, the tooth was almost gone and it's already into the tissue. And the problem with this is that it's painless. You feel nothing.
Why? How could it be painless?
Because, eventually just eats up inside.
So he had no pain?
They had no pain. He had no idea. And he wasn't even making no correlation. I said, "You know what? Your abscess is going to go away." I gave him antibiotic. Your abscess will disappear. It's going to be okay. But you better take care of those 2 teeth you have there because they need to come out. So I took him up there to the dental department. I said, "We're going to do a free consultation." As a matter of fact, all of the patients that come to the office for the first time, they all get a free consultation. They can use it or let it go, but it's one of the services we're providing, so that they can see how state of the art the dental department is, and if they ever need anything, they know that we are there for them. So I said, let me take you up there. I'm going to do a free consultation on you. And I took him up there. We took some x-ray. He got seen by the dentist. I said, they need to come out. And of course, no, at this time, because now he's already having complication of his oral disease. But this week he's coming back because he's already, the abscess have decreased, and he's coming back so he can get that taken care of.
But wait, keep moving now. So now he has this abscess, the disease. Now it's going through the bloodstream, is what you were talking about,
Yes.
into, and I guess the heart is the most,
Well,
easiest.
any organ. Usually the sinuses can be affected, the brain can be affected, because you have to figure your mouth, right? Your mouth is right when you, if you look at an X-ray, sometimes the root of your teeth are right at the base of the sinuses. There's no space in there. Okay, it's very virtual. Basically, the floor of the sinus is the root of your mouth.
Really?
Right. There's no muscle, there's no space, there's no fat, there's nothing. Just that thin bone that is there. So when you have any disease like that, it's one of the things, and this guy developed that abscess, thank God, on the outside of the sinus. But sometimes you see periorbital around the eye, infection around the eye, because all of these things, they are so, they're so close proximity, to each other, that a lot of times we see these areas, and sometimes we see the heart being affected, or the brain being affected, or like I said, a patient with, problem with the feet. And people, they just don't make the connection. One of the things, you have patients with diabetes, and periodontal disease can worsen diabetes and make the diabetes more difficult to control. So if you have problem getting your sugar under control, and they are increasing your insulin or increasing your pill, and you are taking 2, 3, 4 pills to get the sugar under control, get your mouth checked, because your problem might be there.
The nice thing, though, about what you have, the Adult and Geriatric Medical Center, is they don't have to go to the dentist over there, and then go to the ophthalmologist over there, and then go to this person over there, then go to the they just come to your center, and you have everything right there.
We have everything, and we work with each other. We
Except
work
you
with
don't
each
have
other.
you don't have a place to get your dogs taken care
I
of.
gotta do that. I have to
That's what
I
you
have
should
to do the dogs
That's right.
and
A
the
veterinarian.
drive-through. I'm gonna do a drive-through where people can come and get their dental cleaning, just driving your car, open your mouth. Next.
No, they need to see you. That's the love that you give. I have to tell everybody.
The drive-through in the first, when they say, "Can we help you?" Yes. Can I have a dental dental
Open
cleaning?
your mouth and shoot the water in,
dental cleaning
right?
and nail clipping. Okay, go to the next window.
But you just said something about nail clipping, and people are wondering why, because you do have a podiatrist
We
there.
have a
That's very
podiatrist.
and I'll bet the podiatrist catches a lot of things, and you're saying that a lot of those problems lead right up into the mouth.
Right. Now, before we leave, something
Yes.
else?
What?
Very important, because the young people out there say, "Oh, this is not for me. He's talking about dental problems. That must be for the old people." Guess what? If you are a young woman with periodontal disease, it is a huge correlation between premature delivery.
Really?
You lose your baby prematurely, okay, or you will deliver the baby prematurely, or if the baby is born on time, there is a high correlation of low birth weight infants with periodontal disease. So what I tell my patients, if we are going to get pregnant, go up there, get your teeth checked, start prenatal. I have a whole program for my patient when they're going to get pregnant. My young patients that are going to get pregnant.
Amazing.
And even my old patients that want to get pregnant. We have a program
well,
for them.
listen, I think women are going to get. No, I think that's a whole new thing. When the men want to get pregnant too, we got.
And
all this-
well, it's both of
Yeah,
us,
right.
I mean, we got to do it together, because it's equality. Welcome to America.
I know, but wait. I have to tell everybody how to make an appointment. You do need to make an appointment. You can't just run in, because Dr. Mencia has so many patients, and he wants to
954.
spend the time with you. He does. He wants to spend plenty of time. In fact, before I give you the phone number, I have to say this. I have been there many times we could be in a meeting, and when the patient arrives, Dr. Mencia excuses himself, and he goes to this patient, and he gives him a hug.
I don't like my patient to
No,
wait.
I know that, and unless there's an emergency, but everybody there is friendly. This is one of the finest medical practices you're going to find in South Florida. Give him a chance. Go see it. I can't recommend it highly enough. The phone number again. Now get a pencil out. Remember, this is the number in case. Don't wait till you're really sick. Go now. Let him know
prevention.
who you are. 954-489-1345. 954-489-1345. And the article in December that Dr. Mencia will be doing will be on this oral health, because I take good care of my teeth, and I know that it's important, but you have opened up my eyes to a lot this morning. I think
there's a lot more here that's going to be on the article that we couldn't cover in half an hour.
Yeah.
But remember also, use it or lose it. If you have insurance that cover your dental, whether your HMO insurance, whatever insurance that cover dental, use it, or by January 1st it's gone.
Okay, that's fantastic.
And we are gone.
Yeah, we are gone. Thank you, Dr. Mencia. You're so sweet, and we have to say goodbye. Happy Thanksgiving. You going to say Happy Thanksgiving to everybody?
Yeah, well, Happy Thanksgiving, and we will be open that Saturday. The day after Thanksgiving.
Okay, Thanksgiving's on Thursday, and then you're going to be open on Friday and Saturday. And I'll bet they'll have some leftover stuff that you might even have, because Rosemary's a great cook.
No, on Friday, Friday, yeah,
No.
but too much turkey in my belly. Probably on Saturday,
I'd say there'll be
definitely.
some stuffed cookies, things that you get.
Yeah.
No sugar, no sugar. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.